Hello and welcome. Thank you for joining us this afternoon and hope you're all keeping well. My name is Claire. I am Customer Success Director at Doctor Care Anywhere. My role for today is fairly short and sweet, but I just wanted to give you a bit of an introduction to the talk today and who our speaker is. With the constant stream of updates and news around COVID-19 and an ever-evolving landscape of things to do, things not to do, it can become quite a complicated and challenging task to plan for what returning to work might look like, what the new normal is, if you will. This is why we wanted to reach out and hopefully help cut through some of that noise and focus on what's important during this time. Here at Doctor Care Anywhere, we are extremely fortunate that our Chief Medical Officer, Dr. Kate Bunyan, has extensive experience in dealing with infectious diseases, including overseeing the quarantining of a cruise ship in Sydney during the height of the swine flu pandemic, as well as experience managing the containment of Ebola. As such, Kate is very well placed to provide advice and guidance around some of the key considerations for when putting together a return to work plan and how to look after yourself and your employees. Today, she'll provide a recap on the virus and the current advice, guidance on how to minimise spreading. We'll then have a look at the tests that you might have heard about, seen in the news, and what this new track and trace is all about. And then we'll start to put this into a work context for you and look at tips, guidance, assessments, and how you can look after your employees throughout this process. We'll be sending out an information pack following the webinar that will cover all the main takeaways, so don't worry about taking lots of notes. We'll leave some time at the end as well for any questions that you might have and provide some contact details if you want to reach out to us individually or we don't have time for your questions. So without further ado, I'm going to hand you over to the person that you actually came to hear from today. So Dr. Kate Bunyan, over to you.
Thanks very much for the introduction, Claire, and good afternoon to everybody. So I thought today the best way of us approaching this was to cover a bit of a recap, because it really sets the scene for what it is that you're thinking about and why we need to do what we do in terms of thinking about return to work. So to recap, coronavirus, we know, is a family of viruses that ordinarily cause mild respiratory tract infections, so coughs and colds. Sometimes they can cause more severe breathing difficulties and on occasion serious pneumonias. So the ones that we've heard of that cause the more significant illness commonly are SARS and MERS, and the other respiratory coronaviruses, most people haven't even heard of what they're called of. The one we're talking about today is SARS-CoV-2, that's the name of the virus, and the illness it gives is COVID-19. That's what we are talking about at the moment. We know that those at risk of more significant illness from COVID-19 are those who are older and those with other health problems such as heart disease, lung disease, diabetes. And we also know that coronaviruses as a family are spread by respiratory droplets, and this virus is no different. We know that most people get mild symptoms. We know that some people get no symptoms at all. And we know that some people get more severe symptoms, requiring anything up to and including treatment in intensive care. We know that some people are dying from this illness, and we're not entirely sure why some people are more significantly affected than others in other age groups other than those who are older and with complications in their medical history. So how can individuals help reduce the chances of themselves being infected? Again, we know we've heard these a lot now. Wash your hands properly. So we're talking about that 20 seconds under running water, soap and water, scrubbing the fronts, the backs, making sure you interlock your fingers. It's all about making sure that you've covered the whole of your hands and that you're doing it for a good length of time. We're talking about coughing into a tissue, coughing into the crook of your arm so that you're not directly coughing into your hands. And that's important because we don't want you to be taking whatever you've coughed out and putting it down on a surface. We don't want you to be coughing out and then putting that into your eyes. We know that people touch their faces a lot more than they ever think they do. And I think increasingly people are becoming quite conscious of whether they do or don't touch their face. Just as Claire's demonstrated just then, the temptation to scratch and fiddle, we need to try and avoid doing that kind of thing. And we know that it's important to stay at home. If you have symptoms or you live with somebody who has symptoms, then you need to be staying at home. Self-isolation. And what are the symptoms we're talking about? A high temperature, a new continuous cough, and most recently we've also introduced the requirement around a lot of or a change of your sense of smell and your sense of taste. And that's because we know that the sense of smell does seem to be affected in some people as their only sign of coronavirus infection. And we know that taste and smell are quite closely linked. The advice remains, if you're not sure about your symptoms, or if you're unsure about whether you're suffering with COVID-19 or something else, go to the NHS website, use their online tool for symptom checking and follow the guidance in that. But what if you think you have got COVID-19? So the guidance at the moment is if you have any of the symptoms, no matter how mild, you must stay at home and arrange to be tested. Testing for having the illness is now available to everybody. It's being prioritised for those who work within health and social care and for those living in environments like care homes. But if your area has the availability and the capacity, anybody can have coronavirus testing for the illness now. You must then remain in self-isolation for 7 days as a minimum. So after 7 days, or longer if you still have symptoms other than a cough or loss of sense of smell, sense of taste, then you must continue to self-isolate until you feel better. But if you only have a cough or a loss of sense of smell or sense of taste after the 7 days, then you're okay to consider yourself as being free to go about your normal business without being in self-isolation. And the reason for that is that we know that those particular symptoms, the symptom of cough and the symptom of the loss of smell or loss of taste, can go on for weeks after the acute infection, the immediate problem has resolved. And the guidance is that if you can't cope with your symptoms at home, if you're feeling very unwell, your condition gets worse, or if you don't get better after 7 days, if you're still suffering from a high temperature, for example, then you use the NHS 111 online service, their coronavirus service, to find out how you access further assistance. But if you don't have internet access or you're feeling very unwell, the guidance, as always in the UK, is to call 999. That is our emergency medical line. You just call that line and go through the steps as you would do with anything that makes you feel very unwell. Key though is that if you develop new symptoms at any point after you've ended your first period of isolation, you need to start again. At the moment, we don't know a lot about the immunity side of things, and I'll talk about that a little bit later. So at the moment, the rule of thumb is it doesn't matter whether you've had symptoms before and have isolated before. If you suffer again or someone in your household does, then you start the process all over again. And that brings us on to living with other people. If you live with somebody else and you're the first person in your household to have symptoms, you stay at home for 7 days. But everyone else in your household, they still stay at home for 14 days. And the 14 days is important because we know it can take up to 14 days for the infection to become apparent in symptoms. The 14-day period starts from the day when the first person in the household becomes unwell, when their symptoms first start. If anyone else in the household does then start displaying symptoms, they need to stay at home for 7 days from the start. And it doesn't matter where in the 14-day period they are, that's when they need to start their isolation. And if you are the first in your household, at the moment, even if the second person in your household becomes unwell on day 14, you don't then enter a 14-day period at that point. If it's all part of the same episode, then it is just the 7 days for everybody who becomes unwell, as long as they have become unwell within that first 14-day process. And when we say stay at home, exactly what do we mean? Because we're hearing lots about self-isolation and social distancing and different messages about different parts of the country. So what are we talking about? Wherever in the UK you are, stay at home means stay at home. It means that the person with symptoms and everyone else in their household must remain at home. That means they mustn't go to work, they don't go to school, they don't use public areas, and they must not use public transport or taxis. They must stay at home. Nobody from the household should be going out, even to buy food or other essentials, and exercise must be taken within their home. That might be within your garden, but it does mean staying at home. And that needs to happen until the self-isolation period has ended. And just to remind ourselves, that's 7 days for the first person, the index case, assuming that they've got better, and it's 14 days for anyone else in the household, assuming they haven't become unwell. But what about exposure? We're talking now about contact tracing. We hear a lot more about that. So the current guidance for anyone who develops symptoms is that if you have developed symptoms, you may want to alert people that you know you've had close contact with over the last 48 hours, the last 2 days, to let them know that you might have coronavirus, COVID-19, but that you're waiting for a test result. What this then means for the people you're talking to is that they don't actually need to self-isolate at that stage because you're a possible case of COVID-19. But by telling them that you might be a case, you mean they can start thinking about the potential implications of them also being identified as having COVID-19. So they might take more care in their social distancing. They may be more diligent about their hand washing and how they manage their coughing. And they might think about who they are contacting with in the framework of understanding that maybe they might be about to come down with symptoms of COVID-19. What's that about? Swab tests, the test for the illness, for coronavirus, can happen when you're unwell. It needs to happen within the first 5 days of your symptoms starting. And it's a swab sample taken from the throat and the nose. The other sort of testing that we hear a lot about is antibody testing. The test to say, have you had the virus? Now, the evidence suggests that whichever sort of test you might be using in terms of which manufacturer of the test, which lab type of result you're looking at, that test is best done between 3 and 4 weeks after any symptoms have shown. It's a lab test where you have blood taken by somebody, or it can be a home test done by a finger prick. Now, the reason that we hear a lot about these tests at the moment is that these antibody tests are known to be fairly sensitive and fairly specific, which is a really useful tool for understanding how many people have had the virus. But we don't know whether the finger prick way of taking a blood sample is actually as good as taking a formal blood test. So at the moment, the government has suspended anybody selling the tests privately that enable you to do a test at home. And the key thing about the antibody testing is that whilst it's brilliant from a public health perspective for us to know how many people have had the virus and are generating the antibodies as a result of that, what we don't know is whether having antibodies means anything about whether you're likely to get the virus again, or whether you might be fine, but if you got the virus again, you might still go on to infect other people. And we'll talk a little bit more about that in a short while. So if you've had an acute test and you've had somebody actually do the swab test for you, what do the results mean? So a negative result means that the person who had the swab test done did not have coronavirus when that test was done. This is really useful because they can stop self-isolating if they have a negative test, as long as everyone they live with who has coronavirus symptoms also has a negative test result. Anybody who tests positive in their household or who has symptoms and they haven't been tested should be assumed to be positive, and so everyone in that whole household continues to self-isolate. If the patient is negative and they feel well, then that's great. But if they still feel unwell, even though they know they don't have coronavirus, they could have something else, and that can also spread to other people. So they should stay at home until they feel better. Specifically, we're being reminded that if you have diarrhea or if you're being sick, that you should stay at home until 48 hours after those symptoms have stopped. And that's quite common public health practice to help protect others from the symptoms of diarrhea and vomiting illnesses. But specifically, the coronavirus guidance at the moment is calling that out to remind people of the importance of not going out into public and the risks associated with that. If the individual's test is negative and no other members of the household are unwell, then they also no longer need to self-isolate. So they don't need to wait for the full 14-day period if they have no symptoms and the index case is negative. But what if they have a positive result? If they have a positive result, they and anyone else that's in their household must keep self-isolating. They self-isolate for at least 7 days, just as we described earlier, and anyone who they live with who doesn't have symptoms self-isolates for 14 days. You can also get an unclear, void, borderline or inconclusive result. Different tests use slightly different words, but essentially it's just not clear. You may have a positive, you may have a negative, we just don't know. You might be encouraged to have another test done, but anybody in the household needs to consider themselves as that test being positive until it is proven to be negative. So you default to the same that you would if you didn't have a test or you had a positive test result. You self-isolate for 7 days or 14 days if you are an asymptomatic member of the household. Then what's this track and trace business all about? So as part of our opportunities to change the way we are isolating and the significant measures restricting our movements, we're looking at how we can better understand where we're seeing pockets of illness and pockets of people who have coronavirus. And the track and trace methodology is how we're going to know whether we have people extending out from a first case that also then get symptoms and how we control that before it gets more widespread. So why is that important? Well, we think that people can start shedding the virus, so have the risk of infecting others 48 hours before they start to become unwell. And we also know there are some people who don't become unwell at all, and that's a really difficult group then to work out how you manage some of that uncertainty. But if we look back 48 hours over who you might have been in contact with, we can then look at how we contain them, isolate those individuals who might be at risk until we know that they don't have any symptoms and that they themselves are not at risk of further spreading coronavirus. So if an individual gets a positive test result, they'll then receive a text, email or phone call requesting that they log into the track and trace website, create an account, and that's where they will record the details of their close contacts. If they don't have access to the web, then they'll be able to speak to one of the contact trace workers. All the information they share is held in confidence, and the people that are spoken to will never know the name of the indexed person. So that is not shared. What is shared is the fact that you'll be phoned by the track and trace team to say you have been in close contact with somebody who has now tested positive for coronavirus. And hopefully the way we are allowing people to move around means actually you'll know who your close contacts are for 48 hours before your symptoms started. And so you'll be able to talk to those people and say, listen, I'm really sorry, we were together 2 days ago and now I have started to feel ill. So I'm now in isolation, I've got my test tomorrow, I'll let you know the results, or the track and trace system will let you know the results. But the whole point of this is that you don't have to know, you don't have to notify people in advance. The close contacts will be asked to stay in self-isolation for 14 days, but their household members won't be unless they become symptomatic. And then it's the same as anybody else. The symptomatic person and their household then isolate for the 7 and 14-day period. But at this stage, it's only the person who has been the close contact that needs to self-isolate for 14 days. So what's a close contact? So we're using a definition that the WHO are also using for coronavirus, and it means having face-to-face contact with somebody, so less than 1 meter away. Or it's spending more than 15 minutes at one time within 2 meters of someone. And why the difference? Well, if you're face-to-face with somebody within 1 meter for any length of time, then even just talking to each other runs the risk of spraying respiratory droplets over that person. But if you're 2 meters apart, it's less likely that you'll spray them with respiratory droplets just through having talked or breathed near them. But over the course of 15 minutes, that probability increases that some of their respiratory droplets may well have made their way to you. So that's the difference in the 1 and 2 meters and the time factor. And then if you've been traveling in a car or other small vehicle with somebody, even if it's just on a short journey, or you've sat close to somebody on a plane, that would also be counted as a close contact because of the confined space. Anybody who tests positive will be asked for details of their close contacts according to this for 48 hours before their symptoms started. So how long does this virus last on surfaces? Well, there's still some uncertainty as to exactly how long, and there's a lot of research going on to it. But broadly, the research suggests 72 hours is a good base from which to work. And so that's where the UK guidance reiterates 72 hours for a whole variety of different actions. But the good news is that coronavirus is very readily destroyed by the sorts of chemicals that we use regularly and that we call disinfectants. So anything that has the claim on it kills 99.9% of bad things dead. That has to have been through certain testing in order to have that claim. If it has that claim, if it is called a disinfectant, it will work on coronavirus. We know that washing our hands is really important in running water, but we also know that if you can't wash your hands in running water with soap, then using an alcohol hand gel with at least 60% alcohol if it's ethanol or 70% if it's isopropanol, which are the two different alcohol active ingredients in alcohol hand gel, then we know that that also will kill coronavirus. Is there a vaccine or a treatment? No, not yet. And again, these are things you hear a lot about in the news. There is a lot of work being done to develop a vaccine, and there are some really promising signs that we will be able to get to a vaccine, but there isn't one available at the moment. There's also no specific drug treatment that has definitely been found to be effective at either preventing people becoming unwell with coronavirus or helping them to recover more quickly or to have less significant illness if they've taken any particular drug. Lots of really good, powerful studies being done now, but they will take time to give us those answers. The big one that's been in the news a lot is the hydroxyquinolone, the Donald Trump's favourite, and actually recently we have seen some very large-scale studies that have demonstrated that that is not a helpful drug, and actually in some cases it may be harmful. As I said, what do we know about immunity? Well, not a lot at the moment. We don't know whether people can get it again. We know there's a lot of research going into this, but because this illness has only really been around for the last 6 months, the most we would be able to say is that people have 6 months worth of immunity, because we can't predict how long the immunity will continue to last for into the future. So we can't say now you get lifelong immunity from this virus. Much of the knowledge we have about immunity comes from having studied the other coronaviruses. And they suggest that you might get some degree of immunity, but it is certainly not long lasting. And it is certainly not assured for everybody who gets coronavirus. So there is a lot that we still need to learn about what the immunity means. And that then plays back into the story about antibody testing, that if we don't know whether having antibodies means that you are going to have immunity, we don't actually know that there is value on an individual basis to knowing what your antibody result is. We know it's great for us understanding population-based how many people have had it, but we can't yet use it to help predict the future and predict whether people are protected by having had it before. Face masks, face coverings, which is which and what's the importance of them? So a face mask is a piece of medical protective equipment. It's the same as you see on casualty that you're seeing on news all the time. It's those surgical medical face masks. A face covering is something that covers the nose and mouth, and it can be made of all sorts of different materials, and there's loads of guidance giving different suggestions of what they can be made of and how you can make one at home. And they might help to reduce the risk of people who have the virus but don't have any symptoms spreading respiratory droplets themselves. And I stress might because, again, we're not really sure. We know that face coverings will not protect you if somebody else has the infection and breathes over you. We know that they are not that effective, but it might help to change the way the air that leaves you when you're breathing or talking, and therefore makes it less likely that you can spray directly over somebody else if you don't have symptoms but are currently at the point where you might infect others. And on the basis that wearing a face covering that does still allow you to breathe properly, which has to be a key part of the design, if it might help and it has very little negative side effects, then it might be useful to use it. What we are not encouraging is wide-scale use of face masks, because face masks are in short supply, and those people who need to be protected from those who are exposed and are ill with the symptoms need us to keep personal protective equipment for them to use first and foremost. So you only need to wear a mask if you're ill with COVID-19 symptoms and or are looking after somebody with COVID-19 symptoms. If you are using face masks, disposable face masks can only be used once, and there are things you need to know about how to use them effectively and safely. So if you're not ill or you're not looking after someone who is ill, then you are wasting a mask that could be used by someone else. And given that there is a worldwide shortage of masks, it's really important that we take that seriously. So the advice is to wear a face covering in enclosed public spaces if you can't maintain a 2-meter social distancing. And most important of all is this reiteration that the most effective way of protecting yourself and others from the spread of coronavirus is with good hand washing, good cough etiquette, and with keeping social distancing. So what does all of this mean for organisations who are thinking about returning to the workplace? Understanding how the virus spreads helps us to understand why we need to think about how organisations set themselves up physically to prevent the spread of the virus. Understanding how long it lasts on surfaces helps us to understand what we need to put in place for our cleaning regimes in our workplaces. Understanding what individuals need to do to protect themselves helps us to think about what we as organisations need to do in the workplace to make it easy for individuals to do those things and protect themselves. Understanding the ins and outs of isolation, of self-isolation, of household contacts versus individuals, about the role of testing, all of that helps to give us a clear understanding that how long people might need to be in isolation for, the fact that they may have to repeatedly go into self-isolation and be absent from a physical workplace, all needs factoring in to what it means to go back into the workplace. Because people may be bouncing in and out of self-isolation until such times as we know that it is no longer necessary for us to create these bubbles of protected self-isolation. How people get in and out of the workplace, both in terms of their journeys to work, but also their physical getting in and out of the building, is also based off understanding what this transmission looks like and what the risks are for people coming in and out of close contacts. Understanding that it's 1 meter of face-to-face or 2 meters over 15 minutes changes the dynamic and what close contacts might mean and the risks that people have. And really importantly, we must still remember that this is an illness which presents high risks to certain groups of people. There is no treatment, there is no vaccine available. So it is very much still the same problem to individuals that it was when we went into lockdown. There are also additional complexities for those who care for or live with individuals from high-risk groups, and that complexity plays into their willingness and their understanding of the role they can have within a physical workplace environment based off the way those rules apply to those different groups of people. Being able to put all of this together helps us to work out how we return to the workplace. So both the government through gov.uk and the HSE have put some really useful information out around how we think about making workplaces safe to return to in the time of COVID-19. The 5 steps to working safely are to carry out a COVID-19 risk assessment, develop cleaning, hand washing and hygiene procedures, help people to and from work, maintain 2 meters social distancing where possible, where that's not possible, manage the transmission risk. By having gone through the first steps of this presentation, hopefully it's really easy to see why these are the 5 steps to making working safely important. There's specific guidance for a variety of different workplace setups. The key is that many organisations will be a hybrid of these. So you may have both construction and factories as part of your work. You may have lab and office facilities. So individual organisations may need to reference a few of these different sets of guidelines, but they're very useful guidance to help work on the physical structuring of how you can do some of the work that you're doing in your particular line of work. As I said, the HSE has guidance on what risk assessments need to look like and what they should include, but essentially outline factors are considering the nature of the work and workplace. Are you working in patient care or community care? Are you part of a support service? Are you purely retail? Do you have an online and a virtual and a physical presence? Do you have staff who are public facing? Is this all office based? Is this hospitality? Is this all agriculture and outside? What's the work organisation look like? Is it straightforward to maintain social distancing at work? Is it possible to avoid any confined spaces? Is it possible to keep people working in a separate environment that is at least 2 meters apart? Do you have lots of people who have to share the same workplace? Do you have a flexibility around who might be in and sharing that workplace? What does travel to and from work look like for your particular group of workers? Public transport is available, but is still very much being encouraged to only be used by those who really have to. So is there a different way for your workforce to get into work? How does your workplace entry and exit look like? They are often bottlenecks. We're all very used to holding the door open for one another, but that means that we absolutely come within that 1 meter for each other. So is there a process that you need to think about for that activity? What sort of PPE do you need? When you're looking at your risk assessment, is there a need for PPE because it is the only way you can keep people safe, rather than being able to redesign how you relate different people together? And do you have the availability of the PPE you decide you need? Because if you don't, you need to be thinking about whether this is the right time to come back. How can you maintain hand hygiene and availability of hand washing facilities? What does that look like in order to help people help protect themselves? And how are you managing the workplace environment? What's the cleaning regime look like for cleaning frequently touched areas? And have you sat down and mapped what your frequently touched areas are within your office environment or your workplace environment? Because they may be very different to somebody else's. What are the toilet facilities like, and how's that going to work? What do the eating arrangements look like? Canteens or breakout areas, lunch areas, how is that going to work? How do you manage people's tea and coffee processes? All those extra bits that are around the workplace environment and making it a suitable environment in which to work. And what do you do if you have somebody who is symptomatic? So how are you able to identify those who become symptomatic in the workplace? And how do you make sure that those who are symptomatic are able and willing to self-isolate in accordance with the national guidance? And the risk assessment tools that are out there lead you through all of these different areas, thinking through the application of that area for your particular business. And all risk assessments go through the same set of controls, and it's no different for a COVID-19 risk assessment. You're thinking about elimination, substitution, engineering controls, administrative controls, and then PPE. So can you avoid doing it entirely? Could you change the way you do it? Can you engineer it to be delivered differently? Can you put processes and policies in around it to help it be done differently? Can you protect the individual as the very last point in order to stop them themselves being imposed risk? One of the big and one of the toughest things for organisations is when you can't observe the social distancing, when it's simply not possible for people to remain 2 metres apart. What do you do then? How do you continue to run your business whilst recognising that that is just not possible? And the guidance is you should do everything you can that is practical to manage the transmission risk. So go back to the beginning. What is the transmission risk and how do you then manage it? So the guidance says, consider whether this activity actually needs to be done to help the business to continue to operate. Keep the activity timed. So can you keep people 2 metres apart, or 2 meters, no, not as far as 2 metres apart, but for less than 50 minutes? That might be one way of dealing with it. Can you use screens or barriers to separate people from each other so there is a physical transmission break? Can you rearrange the way people relate to each other so they're back to back or side to side and therefore not face to face, and that part of the risk? Can you bring people together in different phased groups? So can you stagger their arrival and stagger their departure times so that they're not all coming together at the same time? Can you rearrange your workforce work patterns so that actually the same team come together and work together all the time, so you're reducing the number of close contacts for a particular group? And by thinking through what is it that the problem is, what does the virus do, how does it work, what are we asking people to do to protect themselves, you can start to think about, well, what does this mean for my business and how do I manage some of these things whilst managing the understanding of what the problem actually is. So where do we even start then with getting back? Key is knowing the relevant guidance. For some, that'll be more complicated than others. They will have more complex business operations that have multifactorial areas, and you might need to read all 8 sets of guidance because they all apply in some way. It might be that you need to read the guidance in England and the guidance in Wales, in Scotland, in Northern Ireland, and work out what that means differently within your organisation. And we've seen that yesterday in Parliament, where those who are our Scottish MPs cannot leave Scotland to come to Parliament because the law in Scotland requires them to remain at their main residence, which is in Scotland. So the law in England might allow them to come back into the House of Parliament, but the law in Scotland doesn't allow them to leave their homes yet. So how does that translate into the issues for your business? And that's just within the UK. What does this mean for your business if you are working internationally? And understanding the relevant guidance for different parts of your business if you're an international business will also increase the complexity of how and when you start back. And talking to your teams, recognising their concerns is a really significant starting point for getting people back into physical workplaces. Discussing your plans early with people in a positive and caring manner, recognising their anxieties, is going to be hugely beneficial in making it a successful return into the workplace. Recognising the power of conversation starters to establish rapport and discuss problems that people are having. So rather than launching into an actual workshop about returning into the workplace, being able to have that more one-to-one engagement with individuals to hear the way they're working at the moment, some of the joys of the way they're working at the moment, as well as some of the pain points. What's going on in their lives, so that we're really clear that we're setting this up as an organisation, relating well to the people who are impacted by the risk. That also then helps to identify specific obstacles that within your workforce you may have. So if you have a workforce that is multi-generational, you are likely to have some people within it who are already in the at-risk group and need to be shielded, and you may well have carers or informal carers who live with people who are shielding, and you'll have to deal with both elements of the problem. Agreeing a return to work plan that overcomes those specific obstacles involves knowing who needs to do what and when. And if the obstacles are just too complex, particularly for individuals, then the role of occupational health becomes really key. And in all of this, line managers are an essential part of the conversations. But how do you also hear their anxieties so that there's a cascade of positive messaging and actual hearing of concern all the way through your organisation? And to that, compassionate and clear leadership is essential at making the return to work, the workplace, successful and safe for all those who are coming back into it. So it's all about your people. It's all about those who are shielding group and can't return to the workplace. Who are they? What does that mean in your work? It means recognising that many patients are in the increased vulnerability group, but actually they could be present in workplaces, depending on the overall residual workplace risk. So whilst the shielding group is fairly black and white, the guidance still says they can't return to the workplace. There's a large cohort of people who are increased in their vulnerability, but who clinically don't necessarily have to stay out of a physical workplace, but it depends. And that really is the key to occupational health involvement. Because there is guidance out there for GPs about returning to work in the time of COVID-19, but because it is both an individual and a workplace risk assessment, GPs won't be able to categorically say for an individual that they can or can't return to a physical workplace. So within your organisation, you'll need to have the ability to combine the individual and the organisational risk assessments to help make the best decision for your people. And the fact that there is no straightforward response will cause anxiety for people who are very aware of their increased vulnerability, but also aware of the need to get back into a physical workplace, and how one organisation deals with getting that particular vulnerability back may need to be very different to another. So just because a colleague of theirs in a different company can go back doesn't mean that necessarily they can, and vice versa. And as well as being all about your people, it's also about those around them, both at home and at work. Workplaces are returning at a different time in different ways. We've already talked about the difference in the different devolved nations, but this also applies within a locality. Some businesses have chosen not to go back at this time. Others have said they would like to go back, and we're seeing that variability. So what does that mean for the individuals, for the jobs they do and the way they do? Schools are opening at different times and with different levels of requirement and different year groups. If your working group involves a lot of people who are children carers or carers of children, then the fact that the schools aren't open will really impact how they can come back to work. Even if only one child remains at home, that is still a dynamic that needs to be worked through. So those informal caring roles, and then those living with shielded individuals, brings a complexity to how your team feel about coming back into the workplace, and just what else they've got to balance around the risks. And then they may have a mistrust of others, both as individuals and of organisations. I'm taking good care of me when I come in, but can I trust that everybody else is playing by the rules? Can I trust that they will stay at home if they have minor symptoms? Or will people come back anyway? My organisation is doing a brilliant job of protecting me when I'm in this organisation, but I've been asked to go to a meeting at somebody else's company. Can I be as sure that they are taking this as seriously and I won't be at risk by going into that other organisation at this time? All of these human factors really play into the bigger question about the return to work process. This is the largest risk assessment we've ever asked people do for themselves. There's no one right answer. The science isn't able to provide concrete guidance. There's a huge amount of information and opinion, and it is increasingly difficult to tell the difference between fact and fiction. The negative impact of COVID-19 isn't fully understood yet, but we do know it's multifactorial. People are worried about the financial impacts, the non-COVID-19 health impacts, the social impacts. This makes it very difficult for people to know what is the right thing to do for them. We know that our Black and minority ethnic groups are the hardest hit by COVID-19 in different ways, and we don't really understand exactly why from a health perspective. So you've got lots of individual concerns that we're asking individuals to make a decision on, and part of that is, do I go back into my workplace? But there are also positives as well, and engagement with workplaces and organisations is vital to help reinforce the positives out of this, that we are better connected, that we have learned how to use technology in a different and very positive way, that we can make the world smaller and more connected, even at a time when we are struggling with how we look after ourselves and our loved ones. So celebrating the positives and taking a positive role in that is going to be really key for people. And the ongoing mental health impact will last for years. People have anxiety related to the individual situation they find themselves in right now. People are processing grief at who and what has been lost. And we won't know the full impact of that for years. There's talk at the moment of a generation who will lose the opportunity to reach their full potential because of the massive impact on the workplace market at the moment. People will have a fear for the future, both in terms of the immediacy financially, but the fear for the future that this has happened, could it happen again? If we don't have a vaccine, or if we won't get lifelong immunity, could we face this every year as a thing for us? It's raised new vulnerabilities for individuals. They've faced up to medical complaints that they've had in a different way. They've had to respond differently. And they've identified vulnerabilities in themselves that they may not have realised before, because that social contact enabled them to just keep going with it despite whatever they have going on. And then there is huge, widespread societal impact, both in the UK and further afield. So the mental health impact spreads across so many different aspects, and organisations we know already play a huge role in supporting the mental health of their teams. But never has it been more important to embed this as a solution and as an assistance to supporting those people within our organisations. So what are the biggest take homes from me on this? Don't rush it. There's a lot of thinking to be done. There's a lot of moving parts, and the default should still be everyone works from home. If, as you're doing your risk assessments, there are too many moving parts to make it straightforward to know what to do, maybe in your particular organisation at this particular moment in time, it's not quite the right time to move back into the physical workplace. But maybe by doing the risk assessments now, you identify what moving parts you would like a different answer to, and then you'll know when is the right time, because you'll know which box needs ticking. And most importantly, talk to and hear what your employees have to say. They are the key to making return to a physical workplace successful. So making sure that it really does take them into consideration will make it absolutely a beneficial process for you, your teams, and their mental health. There are loads of places you can go for additional guidance. The .gov.uk website has all the national guidance on it and is regularly improved and amended. The Society of Occupational Medicine has released a toolkit, and the web link's there. That's been developed with ACAS, CIPD, BITC and MIND, and covers a lot of what I've been talking about this afternoon. It's a really useful toolkit, and if you do have an occupational health provider that you're using, I would specifically ask them if they are making use of the toolkit as part of what they're doing to support you and your employees. Relevant trade unions are also a really key source of engagement. it's more than just a legal requirement to consult with them, because they're doing a lot of work as well with a variety of different organisations to help understand how we capitalise and make it most effective for people to get back into workplaces. And on that, I'll take any questions that you might have down in the chat box, and anything that we don't get the opportunity to cover today, because I'm quite aware that we don't have a huge amount of time left, we can always cover off. We've left the email address on here, so by all means also email in any questions that you have after you've had time to think about it, and anything that you've reflected on from today. Otherwise, Claire, I'll hand it back to you.
There we go. Thank you. Yeah, thank you very much, Kate. That was incredibly informative. As we said at the beginning, there will be an information pack with the key takeaways and also the relevant information throughout. Do use the chat functionality for any questions that you might have, or feel free to get in touch. Kate, I get one from me, and this might be a bit of a tricky question for you to answer, but I guess with all of sort of the news that's coming out with the government of various different things opening up, you know, you've got shops starting to open, there's sort of news of gyms, whisperings of gyms, and all those various things, and undoubtedly other amenities as they're feeling sort of the financial pressure to start opening up. I guess there's a sense that, will there also be, there's absolutely anxiety for employees not wanting to kind of travel into work, but is there also the pressure from employees that are itching to get back to work, and they're seeing all these things opening up, and then all of a sudden, you know, the sort of HR and corporates are getting sort of differing opinions, and they've got to then also communicate out to all of their employees about sort of the different things that they're doing, and kind of rationalize it.
Absolutely, and this goes back to that whole point about it being an individual risk assessment that everybody's being asked to do. It's so difficult because no one person has all the same risk factors and elements to their risk assessment that they're doing to make it a one size fits all. So you'll have some people who are seeing the opportunity and are just desperate to get back into a safe-ish way of social engaging. You'll have those who are very happy that they're able to look at the percentages of people who are predominantly well when they have this or recover easily and say, I'm happy to play the odds game. I understand the probabilities and I'm happy with that. You'll have some who are more than happy themselves, but are desperately concerned about a loved one or a family member that they feel the need to protect, and they don't know how to do that best if they go back out into the big wide world. So everybody is working out what this means for them on an individual level, and balancing a huge complex array of things in an environment where there just aren't hard facts. So nobody can say, yeah, it's absolutely fine for children to go back to school, but we're opening schools. So it's a really difficult decision for an individual parent to say, well, is it okay for my child to go back? Is it really okay? What is it that we're trying to protect here? What does this mean? What does it do? Because fundamentally, none of this is actually going to stop everyone getting COVID-19. What we're really hoping to achieve is to slow the rate down so that we have the right capacity within the health system to deal with whatever gets thrown at us. But at the moment, we can't just say it will go away. And if we can't say it's going to go away, then everyone is making those individual decisions. And ordinarily, workplaces don't need to worry about that individual variability, because it's fine to say, well, this is the way we work. So if you want to work like we work, come and work for us. And now what we're saying is, actually, however you might want to work, some of your employees may simply not be able to work with you like that, but you still value them as employees. So how do we manage that? Totally unique situation for us to have to deal with.
Yeah. And I guess you can already start to see it in, so schools are sort of technically allowed to start opening up. And I know there's other sort of different services, sort of dentistry, stuff like that. I've already personally received communication from my dentist that, you know, they won't be opening as early as is allowed. And I know that, you know, from speaking to family and friends who are teachers, like schools as well are kind of doing that individual assessment themselves and not just going on what the government's saying. But I can imagine it's quite a hard thing to kind of take a step back and actually just do that assessment for your own organisation in the own context of your employees.
Yeah, and the financial viability of your organisation. So it's really difficult to balance the need to drive the economy on an individual, on a local, on a national level with, well, what does this mean for the human factors and the individuals? It's a really complicated tightrope to walk. And I think that's why I'm hoping that today's been a useful session to help people just start to frame up the things they need to think about when returning into a workplace, but also allow people permission to recognise that it's just not that straightforward as picking up the guidance and saying, yeah, the data's arrived, I'm allowed to go, I'll follow the guidance, bosh, on we go. That it is an intricate set of decisions to be made, and there is no right answer, and that also means there is no wholly wrong answer. There's just going to be a lot of grey and individual decisions to be made for individual organisations.
Yeah, and I guess that comes back to your last key takeaway, that the most important thing is to speak to your employees and communicate what actions you are taking, why you're taking them, what it means for them, what it means for the business, so that everyone sort of really understands the decisions that are being made and that reason, and they can sort of potentially, like we said from the beginning, cut through that noise with some of the facts that are important for them. Absolutely,
and that really will give them confidence and empowerment to know that they're an important part of the organisation, whatever's going on, and it's a good way of demonstrating that you have an understanding of their mental health and the journeys they're going through.
Yeah, brilliant. Well, thank you very much, Kate. I haven't seen any questions popped up yet, so if anyone does have anything further that they'd like to speak to us about, the email address is customer@doctoreanywhere.com, and we'll absolutely do our best to answer your questions and support in any way that we can. So thank you very much. Enjoy the rest of your afternoon and your evening, and hope you all stay well.